Hi students, today we are going to discuss about the outlines for LFT, that is liver function test, right? This is very important essay question, clinical scenario, charts discussion in our practical exam or viva question, right? For this outline of LFT, first you should know the normal levels of 10-12 parameters, right? Parameters means like bilirubin, plasma proteins, like that. Okay. The first one is plasma protein. In this plasma protein, you have total protein, albumin, globulin, fibrinogen, and finally AG ratio, that is albumin globulin ratio. Second one is coming to bilirubin. We have three types. One is total bilirubin, second one is conjugated, third one is unconjugated bilirubin. Next one is liver enzymes, that is synthesized from liver in disturbed in some disorders, that is AST and ALT, that is transaminases, aspartate transaminase and alanine transaminase. Next one is alkaline phosphatase. These three are the enzymes for liver disorders. The last one is prothrombin time, because prothrombin is synthesized from liver. So if anything happens to the liver, means that prothrombin time will be prolonged, right? So these are all the parameters you should know the normal values. Okay, right. First you have to start with LFT, the functions of liver. You know all the functions. Number one, all metabolisms, right, occurs in liver only: carbohydrate, lipids, proteins, porphyrins, bile acids, like that. Second one is the clotting factors, very important. Clotting factors are synthesized from liver, some clotting factors. Then bilirubin, after hemolysis the bilirubin enters into the liver. There only the conjugation occurs, then only the bilirubin is converted into conjugated bilirubin and will get excreted by bile ducts, right? Next is urea cycle, because ammonia is very toxic. So in liver, this ammonia is converted into urea and get excreted by kidneys. Next one is this liver is act as a storage, store minerals, vitamins, or like ADEK vitamins, minerals, example iron and copper. It is a storage area. Next one is important function, detoxification or xenobiotics, that is toxic compounds are converted into non-toxic compounds in liver and then get excreted by kidneys. So these are all the important functions for liver. Okay, what are all the disorders involved in liver? We have so many diseases. I'm going to give one or four or five diseases, like cirrhosis, you know very well, hepatitis, viral hepatitis, then jaundice, biliary tree problem, cholangitis, then fatty liver, non-alcoholic fatty liver, sometimes hepatoma, liver cancer. So these are all the common disorders related to liver. Now we are going to identify these diseases with some test, right? That is called liver function test. Okay. Now we are going to classify the liver function test. There are so many books giving so many classifications. I am going to give three important classifications for your university exam essay question. Number one, excretory function, right? Number two, synthetic function. Number three, enzymes related to the diagnosis of liver diseases. These are all the three subtitles, very important for your liver function test. Okay. The first one is excretory function. We all know bilirubin and bile salts, urobilinogen. These three are very important excretory products: bilirubin, urobilinogen, bile salts. Right. And coming to the synthetic function, we have plasma proteins and prothrombin. You know the plasma proteins: total protein, albumin, globulin, fibrinogen, along with AG ratio. Whereas prothrombin is one of the important clotting factor. If anything happens to the liver, that is liver disorders, means the prothrombin time will be prolonged. The normal time for prothrombin, normal prothrombin time is 11 to 13.5 seconds. In liver disorders, the prothrombin time will be prolonged, right? The next one is ALT, AST, and ALP. That is ALT, AST, they are coming under transaminases, and ALP is alkaline phosphatase, which is the marker for both hepatic and bone disorders. Okay. Now we are going to discuss about the excretory function. Bilirubin is the excretory product from heme metabolism. Conjugated and unconjugated bilirubin. You have to know the normal levels of total unconjugated and conjugated bilirubin. Conjugated is direct bilirubin, unconjugated is indirect bilirubin. Already we uploaded one video regarding the Vandenberg test. At your free time, you go through. Then causes for this increased bilirubin. We are having 3 or 4 stages for the increased bilirubin causes. One is hemolysis. Second one is conjugation failure in the liver. Third one is obstruction in the biliary system. These are all the 3 common causes for the increased bilirubin level in our blood. Next one is test is Vandenberg test. In this test, direct bilirubin, indirect bilirubin, and one more important is biphasic bilirubin. That is hepatic jaundice bilirubin, both having the characters of both hemolytic and obstructive. You know the 3 types of jaundice: hemolytic, obstructive, and hepatic. I already uploaded one more video for all the 3 types of jaundice. Free time you go through. Then you have to mention about the urobilinogen, conjugated bilirubin, unconjugated bilirubin in all the 3 types. Regarding urobilinogen, this is very, very important mechanism. It is actually synthesized, derived from unconjugated bilirubin only, because this unconjugated bilirubin is not able to enter into the liver. So directly they will go to the intestine. From the intestines, they will be converted into urobilinogen, then urobilin, excreted into urine and feces. That is a urobilinogen finding is very, very important. That is the hallmark for only hemolytic jaundice. Right? In obstructive jaundice, there will be no urobilinogen. Like that, you have to mention one by one. I have uploaded 3 separate videos for this obstructive, hepatic, and hemolytic jaundice. Free time you go through. Second function is synthetic functions of liver. Here we have 2 parameters. One is plasma proteins, another one is prothrombin time. Regarding plasma proteins, I have uploaded one more separate video in detail. At your free time, you go through. In this plasma proteins, you have to mention about the total plasma protein level 6 to 8 grams per dl, albumin level 3.5 to 5.5 grams per dl, globulin levels 2.5 to 3.5 grams per dl, fibrinogen 200 to 400 milligram per dl, and lastly AG ratio, that is albumin globulin ratio, that is actually 1.2 to 1.5 is to 1. In some liver conditions or kidney conditions or bone conditions, this AG ratio will be reversed. That is, globulin is increased and albumin is decreased. For example, uh, kidney problem, nephrotic syndrome, and liver problem, cirrhosis, and bone problem, multiple myeloma, and chronic infections like that, malnutrition, malabsorption. These are all the conditions. Albumin level is low and the globulin is high. So like that, you have to mention about the albumin globulin ratio. What is the normal ratio? Which are the conditions for the reversed albumin globulin ratio? Second one is prothrombin. This is very, very important. This clotting factor is synthesized in liver. So deficiency of prothrombin leads to prolonged prothrombin time. Okay, I already told the normal time 11 to 13.5 seconds. Usually, it is synthesized in liver, so any liver diseases will definitely lead to increased prothrombin time. In case of vitamin K deficiency, also in case vitamin K deficiency also produces prolonged prothrombin time, because vitamin K is essential for the blood clotting factors. So vitamin K deficiency also leads to increased prothrombin time. So in liver diseases, for jaundice patient, if you want to go for any surgery, you have to measure the prothrombin time before and after surgery. Why? Because In liver diseases, the prothrombin time is prolonged even after the administration of vitamin K. Whereas in vitamin K deficiency only is the problem means after administration of vitamin K, the prothrombin time will be come into normal. That is the differentiating point for jaundice patient who will go for surgical procedures, right? So these two are the synthetic functions. Next one is enzymes, liver enzymes. Actually, the enzymes example are AST, ALT, that is SGOT, SGPT, and alkaline phosphatase. In these three, how they are present in these three types of jaundice. First, you should know the normal level. Actually, AST 4 to 17 international units per liter. ALT is 3 to 15, almost 15 to 20, these two. Whereas alkaline phosphatase, here the unit is for AST, ALT, international units per liter. Alkaline phosphatase is 3 to 13 King Armstrong per 100 ml. 3 to 13 King Armstrong Ka per 100 ml for alkaline phosphatase. This alkaline phosphatase normal in hemolytic jaundice, right? There will be no change. Whereas in hepatic jaundice, slightly elevated, the maximum level is 30 King Armstrong. So, in hepatic jaundice, the alkaline phosphatase level is mildly increased, that is up to 30 King Armstrong units. Whereas in obstructive jaundice, 30 to 300 King Armstrong. This is very, very important MCQ for you. Hemolytic jaundice, the ALP is no change, normal. In hepatic jaundice, mild elevation, that is less than 30 King Armstrong. Whereas in obstructive, 30 to 300 King Armstrong units. This is regarding alkaline phosphatase. ALT and AST is again in hemolytic, this is normal, whereas in hepatic, highly elevated. Whereas in obstructive jaundice, mild elevation, that is up to 300 international units only. Whereas in hepatic jaundice, 500 to 1500 international units per liter. This is regarding transaminases of AST and ALT, right? So for LFT, first you have to mention about the excretory function, then synthetic function, then enzymes in a diagnosis of liver diseases. Okay. For prothrombin time, you have to know the difference between the PT and PTT. PT means prothrombin time, that is how quickly your blood will clot. Whereas prothrombin PTT means partial thromboplastin test. Partial thromboplastin test. It is the test how other clotting factors involved in blood working for clot formation, right? So you should know about the difference between the prothrombin time PT as well as PTT, partial thromboplastin test. Okay.